don't believe a world-class organization. How do you feel about our
Well, it's
local?
world-class, I'm sorry,
Our,
through the
our
chair.
state medical organization, the Ohio State Medical Association, met this weekend for their annual meeting.
Sure.
What is your opinion of our state's doctors who form a large group?
Yes. So, and through the chair, to the representative, so I do understand that you practice gender-affirming care on young ladies, is that correct?
This isn't about me or
Well, I
you.
know, I just want to provide perspective.
This is about a bill. It is not about what I do as a physician, and it's not about what you believe as a representative.
That's true. I just want that to be out there, that people understand where you're coming from. And so what I would really want to know is the science. It's not who says it, but what does it say, and what's the proof? So can you provide me any citations, any evidence?
Actually, I can, but
Please.
so you are discounting any organization that does not agree with you. However, the Ohio State Medical Association just this weekend reaffirmed that gender-affirming care should be offered, it should not be banned, and it should not be made illegal by legislation. So that is a large group that supports gender-affirming care in our state. The WPATH also reviewed 27 different studies, involved 8,000 teenagers approximately and adults. 1% on average expressed regret. What is 1% of 8,000? And again, we're talking small numbers. So 1% of 8,000 expressed regret. And that is a study that looked across Europe, US, and Canada. So realistically, when you talk about regret and about gender-affirming care is not always about surgery. Gender-affirming care can involve everything from supporting the person's mental health to allowing them to live in the true self that they believe. There are plenty of patients who do not look at gender-affirming care as the end being surgery. The other question I have for you is, does insurance cover gender-affirming care under the age of 18? And you've already addressed what I do, and as a surgeon, I can answer that question, but I'd like to know your answer.
So, first of all, I want to make sure I got all your questions. So first thing I would ask you is, how many children do you want to sacrifice? Because the fact that you say the numbers are small does not make them insignificant. We had a young lady in here last year, and one of the representatives basically looked at her and said, "You're insignificant," in so many words. And she said, "I am significant." So that would be my follow-up question, that every one of these children is important.
And I would agree with that.
We should save that choice till adulthood. Number two is most are private pay under 18. I think we both understand that. We know that. But people do get private pay, and this is being performed in Ohio. There are links in here to two spaces in Ohio, the Cleveland Plastic Surgery Center, and then there's another one here in Cleveland that performs this procedure, top surgery, on minors, and I have documented evidence in my notes, so I hope you'll take a look at that if you dispute it. I'm going to make sure I get your. So again, you're doing the same thing that my good friend Representative Liston.
No, I am.
You are saying, if you'll please allow me to finish, I'm happy to hear your response, but you're quoting organizations, but you're not quoting studies. You're not revealing studies to me.
So the organizations don't make resolutions or statements without reviewing the evidence. That would be foolish. The other thing, as Dr. Liston stated, is, again, when you are looking at gender-affirming care, you are looking at all of the data, not just specific examples, not just one person's experience. We are looking at the cumulative data. So to create testimony based on your specific cases, your specific friends, your specific parents, that is not data, that is not science. Science is looking at objective data, not just specific examples.
I appreciate that.
Thank you.
So I totally appreciate what you're saying about the data. So we don't have data. That's why it's an experiment. That's why we're saying save adolescents from experimentation, through the chairman. You've only been doing this in Ohio for minors for 9 years or less. That's less than a decade. You will not. One thing you will not see is someone who will come in here and say, "I'm 30 years old and I transitioned as a minor in Ohio." Because a person who transitioned at the age of 10, when we first started in Ohio, will be 19 years old. And so they have not been able to grow up, and we don't have older, middle-aged people who've transitioned as minors. They don't exist in the hardly ever in the United States. In Europe, you're talking about data. You should read this book, Time to Think, and it talks about the data at the Tavistock with the JIDs, and why are all of the European countries were ahead of us, and they have stopped because the data doesn't support their hypothesis. And while they're putting the brakes on in Europe, we're stepping on the gas here in America because we don't want to pay attention to the data and the scientific evidence that is available and that has been clearly demonstrated. And by the way, most of them are way more open-minded than we are, and they're just looking at the science and they're looking at the facts and they're saying, this doesn't do what we thought it would do. And it's experimental, and we should not have to be proven the harm that it does. You should have to prove that it is good scientifically. And really, it's just a hypothesis. It's just a guess. There is no evidence. And you still have not, all you've done is cite associations and tell me how credible the associations are. I don't think they're all that credible. And a lot of people, a lot of doctors don't think they're all that credible. And so maybe you do, and that's certainly, you're right. But I want to see citations. And most of those citations that they have are low-quality evidence, and that's not an opinion. That's actually a statement that they have to write on their research, as you well know. And they're low-quality evidence for their studies. We want the high-quality evidence that supports it. No one in here has given me that. No one here has recited that or
Could you
provided
define
that to me.
high-quality
I'm almost
evidence?
done. I'm almost done.
Define high-quality
almost
evidence
done.
for me.
So that is defined by the medical associations, by the researchers. And I would like for you to provide me some.
No.
Representative Liston, my good friend, and I said, she's the first person I ever talked to about this, honestly, after I talked to the parents and the families who were hurt by this. And I wanted to get some of her opinion. But again, in fairness, we've had some conversations, but I haven't received any evidence from her or from the Ohio. We sent a whole list to the Children's Ohio Hospital Association. They have not responded. They said, tell us what you want to know. We sent them a list. They never responded to our list. So there's no evidence. If there was evidence, I would think that in 2 years, someone would give me the evidence instead of saying, oh, trust us because we trust this association. I don't necessarily, I mean, I don't dislike you, but I'm not going to make a decision based on your trust. When I got families and when I got detransitioners crying and telling me this doesn't work, this is just a rapidly growing phenomenon of people who are coming out of this and saying, I was lied to. No one challenged me. No one addressed my other issues, my comorbidities. They just said, this is the way. It's affirmative gender affirmation only in most of these places. And just if you say you're a girl, you're a girl. If you say you're a boy, you're a boy. And we allow these kids to self-identify rather than checking into the comorbidities. And I believe that's irresponsible, Dr. Somani.
So there is a definition for quality or evidence-based.
Please share that with me.
High quality. Essentially, if you think about it, a design of a study and the endpoints measured affect the strength of the evidence. Mm-hmm. So at the bottom are expert opinion case reports, which is what you are giving us. You are giving us case reports about the individual people that talk to you.
So you're talking about my oral testimony.
Next are observational studies and randomized control trials, which rank above your case reports and expert opinion. And then at the top are meta-analysis, which is what I mentioned, review of 27 studies and systematic reviews. That's what ranks at the top of hierarchy when you look at evidence-based medicine.
Okay.
So to come in here and quote individual examples is not high-quality evidence. So I'd like to know what your high-quality evidence is.
Through the chair to the representative, have you had the opportunity to read my notes? In testimony, yes, I'm giving you anecdotal evidence. Check my footnotes. They are high-quality sources from, not all of, some of them, it's a mix, but many of them are high-quality sources from medical resources.
You also mentioned that there are no mature adults who transitioned as children.
Not in Ohio for sure, but they are.
There are, and
really?
Yes, there
so
are.
They did this illegally?
There was, you know what, that's not important, how they got care. What's important is that we have medical students here in Ohio that testified to the fact that gender-affirming care was important, that it was important to them, and that as an association, it's something that should be supported.
Where did they testify?
During the annual meeting at the Ohio State Medical Association. These are medical students.
Okay. Please send me that information.
Sorry, go ahead. Thank you. Through the